Pregnancy is such a joyful and exciting time, but it can also come with challenges. One of those challenges is preeclampsia, a complication that affects some expecting mothers. Preeclampsia, also known as toxemia, is a condition marked by high blood pressure and protein in the urine, usually appearing after the 20th week of pregnancy. While it typically happens in the third trimester, it can also develop earlier in pregnancy or even after delivery. Preeclampsia is a serious condition that needs careful monitoring and management by healthcare professionals. Understanding the signs, symptoms, and risks associated with preeclampsia is really important for expectant mothers to ensure a healthy pregnancy journey for both themselves and their babies. Preeclampsia affects about 5 to 8% of pregnancies and can range from mild to severe. It's important to remember that every pregnancy is unique, and not all women experience preeclampsia in the same way. However, being informed about this condition will help expectant mothers recognize any potential warning signs and seek timely medical care when needed. Throughout this video, we'll dive deeper into the symptoms, causes, potential risks, and treatment options for preeclampsia, giving you the knowledge and tools to navigate this pregnancy complication with confidence and ensure the well-being of both mother and baby. Knowing the symptoms of preeclampsia is really important for early detection and timely medical intervention. High blood pressure is a key sign of preeclampsia. Regular checkups help monitor blood pressure. Protein in your urine, called proteinuria, is also an important symptom. Sudden weight gain and water retention are another sign. Swelling in your hands, face, and feet is a common symptom. Persistent headaches and vision changes can also happen. Upper abdominal pain and nausea are other symptoms. Talk to your doctor for the right diagnosis and guidance. Early detection and management are key to preventing serious complications. The exact cause of preeclampsia is still a mystery, but researchers believe it starts with problems in the placenta, the organ that nourishes the developing baby. In preeclampsia, the blood vessels supplying the placenta may not develop or work properly, limiting blood flow and oxygen to the baby. Several risk factors can increase a woman's chance of developing preeclampsia. These include chronic hypertension or high blood pressure present before pregnancy, as well as pre-existing conditions like diabetes, kidney disease, and autoimmune disorders. A first-time pregnancy and being pregnant after age 35 also carry a higher risk. Multiple pregnancies, such as twins or triplets, pose a higher risk due to increased demands on the placenta. A family history of preeclampsia, especially in a mother or sister, can also increase the likelihood. Other factors include obesity, in vitro fertilization, IVF, and a history of preeclampsia in a previous pregnancy. While not all risk factors are modifiable, understanding these factors can help healthcare providers identify women who may benefit from closer monitoring and preventative measures. By addressing modifiable risk factors, such as managing pre-existing conditions and maintaining a healthy weight, expectant mothers can reduce their risk of developing preeclampsia. Part 4. Potential risks and complications. Protecting both mother and baby. Preeclampsia can have serious consequences for both mother and baby if left untreated. For expectant mothers, it can lead to eclampsia, a life-threatening condition marked by seizures. Other maternal complications include HELLP syndrome, a severe form of preeclampsia affecting the liver and blood clotting, as well as stroke, kidney damage, and fluid in the lungs. Preterm birth, or delivery before 37 weeks of pregnancy, is a common complication for babies born to mothers with preeclampsia. Premature babies are at increased risk for breathing problems, difficulty with feeding, developmental delays, and other health issues. Preeclampsia can also restrict fetal growth, leading to low birth weight. In severe cases, preeclampsia can lead to placental abruption, where the placenta separates from the uterine wall, depriving the baby of oxygen and nutrients. This life-threatening complication requires immediate delivery. Stillbirth, although rare, is also a potential risk associated with severe preeclampsia. These potential risks and complications highlight the importance of early detection, prompt treatment, and careful monitoring throughout pregnancy. By working closely with healthcare providers and adhering to recommended management plans, expectant mothers can minimize risks and improve outcomes for both themselves and their babies. Part 5. Treatment and Management. Navigating preeclampsia with confidence. The main goal of preeclampsia management is to prevent complications and ensure a safe delivery for a healthy baby. Treatment options vary depending on the severity of the condition and how far along the pregnancy is. For mild preeclampsia, close monitoring of blood pressure, protein levels, and the baby's growth is really important. Bed rest and lifestyle changes, like lowering salt intake and drinking more water, might be recommended. In more serious cases, going to the hospital might be necessary for closer monitoring and management. Medicine, such as blood pressure medication to lower high blood pressure, and corticosteroids to help the baby's lungs develop, may be prescribed. Regular blood tests and fetal monitoring are essential to check on the health of both the mother and the baby. If preeclampsia gets worse or the baby's health is at risk, delivering the baby might be the best option, even if the pregnancy isn't full-term. Healthcare providers make this decision carefully, considering how serious the condition is, how far along the pregnancy is, and the possible risks and benefits for both the mom-to-be and the baby. After delivery, most women see their preeclampsia symptoms go away, but monitoring continues after delivery to make sure of a full recovery. Long-term health effects, like a higher risk of heart disease later in life, are possible, highlighting the importance of ongoing healthcare and healthy lifestyle choices. Part 5. Treatment and Management. Navigating preeclampsia with confidence. Rest of the script follows the same translation pattern. Part 6. The Importance of Prenatal Care. Your partner in a healthy pregnancy. Regular prenatal care is super important for a healthy pregnancy, and it plays a big role in finding and managing preeclampsia early. Regular checkups give healthcare providers a chance to keep an eye on blood pressure, check urine for protein, and get a good overall picture of the health of both mom and baby. During these visits, expectant moms can talk about anything they're worried about, ask questions, and get helpful advice on having a healthy pregnancy. Healthcare providers can give personalized tips on good food choices, exercise, and lifestyle changes that can help lower the risk of preeclampsia. Prenatal care also provides a chance to learn about pregnancy complications, including preeclampsia. Expectant mothers can learn about the signs and symptoms, risk factors, and possible problems, which helps them take charge of their health and get medical help quickly if they need it. By going to all their scheduled prenatal appointments, expectant moms can build a strong relationship with their healthcare providers, encourage open communication, and make sure any potential problems are identified and addressed early on. This proactive approach is essential for a safe and healthy pregnancy journey. Part 7. Empowering expectant mothers. Tips for a safe and healthy pregnancy. While preeclampsia can be a serious complication, there are steps expectant mothers can take to promote a healthy pregnancy and minimize potential risks. Maintaining a healthy lifestyle is crucial, including a balanced diet rich in fruits, vegetables, and whole grains, as well as regular moderate-intensity exercise with the approval of healthcare providers. Managing pre-existing conditions, such as diabetes and high blood pressure, is essential. Working closely with healthcare providers to monitor and control these conditions can significantly reduce the risk of preeclampsia. Getting plenty of rest and staying hydrated is also important, as is avoiding smoking and alcohol. Attending all prenatal appointments and following the healthcare provider's recommendations is paramount. This includes taking any prescribed medications as directed, monitoring blood pressure at home if advised, and reporting any unusual symptoms immediately. Remember, knowledge is power. By staying informed about preeclampsia, recognizing the warning signs, and taking proactive steps to manage risk factors, expectant mothers can navigate this pregnancy complication with confidence and embrace the joys of motherhood with greater peace of mind.